Hello, I'm Kurt Barnhart, the video and media editor for Fertility and Sterility. I have the privilege of being here with Professor Dr. Bianchi, who just gave the Carmen Nazat Presidential Lecture at this year's ASRM. Dr. Bianchi is the Natalie Zucker Professor of Pediatrics and Obstetrics at Tufts University and is transitioning to be the director for NICHD.
Kurt, I thank you for inviting me to speak here. What I talked about was analysis of cell-free DNA in the blood of pregnant women, this non-invasive prenatal testing, which is the fastest growing genetic test in history and really revolutionizing prenatal testing. I focused on how the test is done, the clinical impact, which is that it's reduced 70% of the invasive procedures that are being performed worldwide. And then I talked a little bit about the false positive cases, mainly autosomal trisomies that are being detected in ongoing pregnancies, sex chromosome mosaicism, and then tumor DNA that can be shed into the maternal circulation.
So mosaicism is something that we banter around quite a bit, and you did mention that you can find mosaicisms in these prenatal tests. How do you think that affects what we're doing with pre-implantation genetic screening?
Approximately 0.31% of non-invasive prenatal tests have evidence of trisomy of other chromosomes, and these are in ongoing pregnancies. So I think for the ASRM community, it raises the question as to whether some of the embryos that are normally being, that are not being transferred could actually be transferred, because we're seeing in nature that these are ongoing pregnancies and they're seemingly well.
So thank you very much, and we really appreciate your transition to becoming the director at NICHD, and we hope that we can work with you and continue working such. And again, thank you for your time.
Thank you.